Developing tonight, one of the top providers in our community says the mental health crisis is changing.
Now, Rosecrance says it's now adults in our community who need the most amount of treatment for addiction and mental wellness. Our William Ingalls walks us through how Rosecrance will try to tackle those changes head on.
Rosecrance's Griffin Williamson campus was built 20 years ago to help teenagers battle mental health crises. But today, they aren't the age group that needs these inpatient services the most.
Then you look at the adult demand for substance use disorder residential care, and you start to see waiting lists. And these are the people who used to be teenagers that maybe received the care earlier or now into their 20s. And these are these people that we're seeing dying in droves by overdose.
Rosecrance President and CEO Dave Gomel says the health network is trying to meet that need head on, converting 40 beds at this facility from teenage use to adult use. But even that won't erase a large waiting list in our area.
Our demand for adult services won't be met in full by this addition. We could continue to add beds and meet that demand.
The transition will cost $750,000, which is 80% paid for thanks to donations and state grants won by State Senator Steve Stottleman. He says the price tag to pay for mental health services at a state and county level might look high, but the community ends up paying one way or another for untreated mental health care.
We see it in crime rates, we see it in jail populations, we see it in lack of education, lack of educational attainment. Every challenge we face in this community many times is often connected to lack of mental health services, and so we need to invest in this area.
The shift will make a total of 133 beds for adult inpatient needs, or just 28 for teenagers at Rosecrance and Rockford. But Gomel says the need that they see for teens right now is in outpatient care, with this shift either leaving no wait list or at least a very small one.
We're going to continue to provide services for what we think the demand is without running waiting lists for kids or very, very small waiting lists.
One step of many that will work to help people with mental health challenges in our community heal. For 13 WREX, I'm William Ingalls.
And Rosecrance has a separate 93-bed facility dedicated to adults on Harrison Avenue.
And still